Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, the legislature is back for the fall session. Two huge topics on the agenda: health care, energy. Both subjects we'll take up on this edition of Pennsylvania Newsmakers following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, I'll tell you, there couldn't be two more important issues to discuss than this week's topic, health care. The governor has a very ambitious health care set of proposals before the General Assembly. We want to talk also about the Pennsylvania's Clean Indoor Air Act. A huge debate took place before the legislature adjourned over the summer about what we call a smoking ban in public places. And then energy. There's a special session on energy. John Hanger from Penn Future has been on the program on a number of occasions, has stopped by to chat a little bit about the governor's energy proposal in the second part of the program. But now joining me, as often is the case, is the president of the Pennsylvania Medical Society, Dr. Mark Piasio. Doctor, welcome.
Terry, nice to be here
again.
The
doctor is in the house.
In the house.
As they
nice
say.
to be
We got
back.
a couple doctors in the house here. All right, look, the Clean Indoor Air Act, you've got competing bills going on in either chamber about what restrictions, or let me put it this way, about what exemptions should be made when we start talking about banning smoking in public places. And the debate is all over the ballpark. Restaurants exempt, no. Taverns exempt, casinos exempt. Weigh in on this. This is something I know the healthcare community is very much interested in.
Well, this is a priority issue for us, and for a whole host of reasons. Let's just look at some of the facts first. Second-hand smoke, is a Class A carcinogen by the FDA. That's the equivalent of asbestos and radon and formaldehyde. 53,000 people a year die from second-hand smoke. 22,000 Pennsylvanians die a year from smoking. Smoking, we feel, contributes $5.1 billion of unnecessary health care costs to Pennsylvania alone. So when you're looking at why do we want to move in this direction, first and foremost, we're physicians. This isn't good for you.
Well, no kidding. I wouldn't expect you to come on and say anything
even
else.
Just looking at the economic aspects. But in looking at in getting smoke-free indoor environments, it helps smokers smoke less. It keeps them from smoking. It keeps teens from smoking. Others will argue and say, well, I should be able to do what I want, where I want. There are two issues with that. Number one, though you may want to do something with your health that's not good. Number one, it is costing me in my health care premium. But number two, I think your right ends at my lungs. And I should not have to be exposed, nor should, most importantly, an employee. So no one should have to choose between a job and their life. So for those particular reasons, we find that the stronger of the bills is the one to go with.
Which would mean with no exemptions in the...
The governor's bill is very strong. They have very few exemptions. You can smoke in your home unless it's used for child care. You can hotels can still have some smoking areas within them in some of the rooms. And if you're an establishment that predominantly sells tobacco products, such as a smoker, you can do it there.
Smoking
but
rooms
that's
or
about
cigar rooms or whatever they're called.
That's about the limits. And when we strongly support that bill, we think that that's the right way to go.
Why do you answer when this debate takes place, it often takes place about the individual rights of sort of the owners of restaurants and taverns to say, this is my establishment, I'll decide. Is your argument based on predominantly on the healthcare side, that we regulate all sorts of things? Go ahead.
I think the argument is that may be a business situation for them, but the Restaurant Association has already found that when they go smoke free, their business goes up. For us, it's predominantly this is a medical issue, but it is an employment issue as well, and that's where we feel that though you may want to have the right to do these various things, what you're doing, your risky behavior, is adversely affecting those around you, whether they're an employee or another customer. And for that reason, like everywhere else in society, you have your rights and privileges until they adversely affect your neighbor, and that's where they end.
Yeah. Now, in terms of the debate, it looks like the legislature, well, I don't know, there's still some issue about whether they take this up. I mean, are you actively promoting in the legislature that the governor's bill be put into law? How active is the medical community on this?
We're very active on this issue. We've supported the governor's plan on this and the House bill that came out supporting the same.
Yeah.
We think this is a critical part of his health care reform package. Healthy living and personal responsibility for things that we do that affect ourselves and others are going to be part of any health care system reform debate. And this is a great place to start. All of our contiguous states have already gone this route.
Right.
We're the sole remaining outlier.
All right. We're going to talk when we return. We're going to take a quick break. The governor has also proposed covering some 900,000 folks who are uninsured. It's a huge issue at the national level where the presidential candidates are weighing in with their national health care plans. We're going to ask Dr. Piasio what he thinks about the prescription for Pennsylvania. Is that what it's called?
I believe it still is.
I think that's the name.
Yes.
It still is. It hasn't changed. We'll be back with Dr. Mark Piasio after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania. Well, the doctor is in the house. In this case, Dr. Mark Piasio, the president of the Pennsylvania Medical Society. We've not even gotten any medical advice. We should have had you on giving some medical advice to people, but we won't go there. Look, prescription for Pennsylvania, 900,000, about 900,000 Pennsylvanians don't have coverage. Huge debate in the Pennsylvania legislature since the governor made his proposal to cover folks, proposal he made in last February. Let's talk about that plan. What do you like in that plan and what don't you like in that plan?
Well, the first thing we like about the plan is there's a plan. Since 1992, we've been talking about our uninsured and have done nothing about it, either nationally or statewide. Those ranks have grown nationally to 47 million.
Right.
And though some may argue that, well, these people are in and out of insurance products as their jobs change, that's fine, except if you get sick while you're in between, at which point you're looking at financial ruin, and emergency rooms are not the safety net. So not having a solution to that is not a problem, it's a national tragedy. So at least in looking at the coverall Pennsylvanians, we're making a start. And what we like about it is I think most of us agree that we're only going to solve this through a cooperative between the private sector and the government sector, that neither one is going to be able to do it very well and has never done it particularly well on their own.
If they do it alone.
If they do it alone. We've seen how both of those systems are kind of failing. Right. So at least there's a cooperative between the two. They do produce a product that's a core benefit package. It's not an all-cover package. It's a basic package. It's priced close to what it could probably be delivered for, and it involves a little bit of cost sharing by everybody, business, the patient, the insurer, physicians, hospitals. Everybody's got to give a little bit. But in return, we get health care for a large segment, and as we're finding out now, that the segment of uninsured is no longer just those at the federal poverty level. It's actually creeping up into those with median incomes of $50,000 to $75,000 to $100,000. And as you heard earlier, from the business community, it's getting harder and harder to purchase. So those things we like about the plan.
Right.
Some of the things that we have...
What are your reservations?
Well, reservations are going to be, number one, we want to make sure that those who are already providing it, that the penalties for trying to get out of providing it and trying to get into the coverall Pennsylvania plans are stiff, so that that doesn't occur. We want to make sure it doesn't grow like the medical assistance program with lots of mandates and lots of excessive coverage, so that it does become unaffordable and unsustainable. And
one of the dangers when you get too much government regulation is that can occur, such as in the Medicare and Medicaid programs.
Right. Particularly, we look at our Medicaid program here, and it's becoming unsustainable. It's becoming a larger part of the budget. If we don't do something about it, soon we can't pay for roads and education. So we need to make sure that the plan stays manageable. Now, the other problem, of course, with it is that it's not readily available. It'll take some time to develop, and it may not be available right away. However,
go ahead, finish your point.
But it's a start, and it needs to be debated, and something needs to be done. It can't just be tabled and put away because 47 million people. Yeah, but is this something that really each state should be doing? I mean, I just can't believe that we're going to solve what's a national problem by having each state sort of set up their own individual plan, paying for it in different ways, with different mandates, with covering different segments. I mean, I know that you take a state like Massachusetts, which has a lot of people covered with current policies, an older population, many of them on Medicare. Well, look, how do you compare that with Texas? Right.
You know,
there's a large difference. Actually, Pennsylvania is a lot like Massachusetts. We do have a fairly low number of uninsured, so we're one of the states that can do it. Like it or not, health care has become a state issue. It seems to be delivered state by state, which makes it difficult for bigger corporations to move in between when they're multi-state, multinational. However, states do have the capacity, because they're small, of being able to do something. And they can be incubators, too, to try innovative, novel approaches.
Well, that's true. That's true.
And we have one. So
that's true.
We should certainly give it a try. And looking at how we really deal with our healthcare system reform, there was a good article came out of actually the AMA, out of their ethics forum, and looking at what we really need to do as a nation. And in looking at what needs to be done, we need to develop a core benefit package that's limited, but it's designed for cost, quality, and access, but designed through an ethical process. And I think that the CAP plan is going down that road. It needs to have some sustainability of the system, and there needs to be personal responsibility and accountability. And all these things are being addressed in the plan, so at least we feel, from that perspective, it's a start.
All right, thanks for coming in, chatting about health care. We're going to turn to energy. Governor has a very ambitious program, hotly debated in the legislature. We'll take that up following these messages.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Joining me is John Hanger. He's the president of Penn Future, an environmental organization that promotes, what do you promote? Come on.
We promote a clean environment and a competitive economy.
There you go. There you go. All right, John, I want to talk a little bit about the governor's energy proposal. The legislature is in special session. That means there's a focused effort going to be made by the governor to pass his energy bill, which has a series of proposals in it. I'm going to let you go through the specifics of it, and then we can sort of talk about what you like and what you don't like about it. Go ahead. Go through the major elements of it.
Well, the governor's proposal was first unveiled in February, and with his speech to the joint session, he merely, I think, repeated the points that he's been working for since February. And there are really 3 or 4 major pieces to it. First, he wants an $850 million fund created to support and finance alternative energy, wind, solar, and conservation projects. He would propose that fund be financed by a small user fee on electricity. It amounts to about 45 cents a month for the typical residential customer. He also favors something called smart meters. He wants these devices that would help customers control their electric bills and reduce the peak electric demand.
So that's on the conservation side of
it.
Go ahead.
He wants to reduce demand for electricity where possible. He's also in favor of strong conservation programs, again, to reduce demand in addition to the smart meters. And he has a proposal to increase biofuels, essentially transportation fuels made from crops and
that's
plant
a
waste.
national wave now. This is just not, I mean, a lot of this is going on throughout the country as a whole and state by state, but this whole business of biofuels and reducing our need to have oil in particular from places in the world that are, not as safe and not as ensured that we'll get the energy. But there are lots of different reasons, I think, to get rid of the dependence on oil, as I'm sure you would point out. But let's take this piece by piece. $850 million, $1 million bond issue he wants to float. Good idea or bad idea?
I think the key is the size of the fund. Believe it or not, if we cut that fund, we might as well not spend anything and save all our money. We can spend too little to have a difference, to make a difference. The test for seriousness here on energy independence is, are we going to have enough investment to actually make a difference?
Right.
Or are we just playing political games? So the $850 million amount, I believe, is actually at the small end of what really can make a difference. So we favor at least $850 million.
And there are competing proposals in the legislature, particularly in the Senate, where the Republicans have a $250 million sum of money on the table for these programs. You would argue that's not enough.
And $250 million is clearly not enough.
Yeah.
That's a recipe to lose the battle for energy independence. And I would just make one tweak to your comment. I don't think that proposal is a quote-unquote Republican proposal. I think it's a proposal of a few senators.
Oh, okay, I got it.
Senator Mary Jo White and
I got it.
Senator Tomlinson.
Okay, well, that's a good point. We'll see what all of the Republicans do. But
exactly.
A good correction, a good correct. You know, I want to talk a little bit about one of the things that's gotten, strangely enough, controversial is one of the elements of his program is for the use in the homes of smart meters. And there's been a kind of debate about what they do. First of all, for our viewers out there, some of whom might have smart meters, what is a smart meter? Explain that.
Yeah, actually many viewers, particularly in the PPL electric service territory, already have a smart meter in their home and probably don't even know it.
Really?
Absolutely.
You mean I could have one and I don't know it?
I have one in my home, and I actually do know it, but I'm not able to use it for all its purposes. Here's a prop. It's a cell phone.
Okay.
What a smart meter does is simply record how much electricity is being used and the time at which it's being used, which is what a cell phone does, how many minutes you're using and when the calls were made.
Sure.
That data trail allows cell phone companies to offer you all kinds of pricing programs. You can get a program where you don't pay anything if you make calls on the weekend or after 9 p.m. If the phone didn't record when the calls were being made, you would not be able to get that kind of pricing program that differentiates the prices by time.
Right.
The dumb meters that a lot of people have in their properties right now don't record when the electricity is being used. All they do is give you a total amount of electricity use after 30 days.
All right, hold that thought. We're going to run to a break. This is a fascinating subject, and you would argue this is pretty important to help regulate when we use electricity at certain times?
It's absolutely vital for consumers and for the free marketplace.
All right, hold that thought. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to Newsmakers with John Hanger. We're talking about the special session of the Pennsylvania legislature, and in particular the governor's energy independence strategy. John, before we leave this smart meter thing, is this something that folks can go and, go to, a Walmart or, you name the store, and pick up?
No, and that's the reason why it's a matter of legislation. Your local utility is the gatekeeper on the smart meter.
Really?
And your local utility, electric utility, is still a monopoly when it comes to delivering electricity to your home. So most of the utilities have not deployed these smart meters. They've kept on replacing one dumb meter with another dumb meter.
Yeah.
And so now the legislature is debating whether to require them over a 6-year period to, in fact, install smart meters.
Now, is that controversial?
Well, I think there's been some debate and a lot of misinformation about it.
Yeah.
Having smart meters in the property will give customers more choices, give them more tools to control their electric bill, and it helps the free market for electricity actually work. Those who like markets ought to be in favor of smart meters.
Okay. I want to turn now, in the time we have, to this whole biofuel business. Can one state really make a difference?
Well, one consumer actually can make a difference. And a state the size of Pennsylvania can really actually make a difference. You're, though, correct that it would be better still if the nation as a whole moved in the direction of true energy independence. And I guess what's frustrating to so many people is we know deep in our bones that we've been losing our energy independence ever since the first Arab embargo in 1973.
It's a national security issue now.
It is, and
plus, in addition to being an environmental issue,
you've got some very conservative national security hawks lining up with the left wing and the environmentalists on this issue. Because of the national security interests. And I think whether you're a Republican or a Democrat, you're tired of buying so much oil and energy from places like Saudi Arabia, Iran, Iraq, etc. I will say something that I think which troubles me. Every time I go to a gas pump, I know some of my dollars are going to regimes and dictators and kings that hate America and, very frankly, have financed terrorism. I hate having to do that.
Oh, I understand. I think a lot of Americans feel that way. Give me an example of how what the governor wants to do with biofuels, how that might work in Pennsylvania. Give me some.
Yeah, well, he is following in the wake of a few other leading states, and indeed the national government has started to adopt policies requiring an increasing amount of transportation fuel to come from biofuels. And already, actually, in the Philadelphia area, 10% of the gasoline, quote-unquote, gasoline you buy is actually biofuel. So it's 90% gasoline and 10% ethanol. And what the governor is requiring would be that over a period of time, that 10% standard that's already met in the Philadelphia area be met statewide. And then on biodiesel, which is a diesel product made from plant material, he has a similar requirement that over a period of time we increase the amount of biodiesel that is in the diesel mix.
Right. All right, we have about 30 seconds left. Let me just ask you this this remaining question. Big debate in the legislature. Prognostication on the success of some or part of this?
Well, I think it frankly could go either way. The thing that I'm most concerned about is that we will do small things that make no real difference because the politicians need to be able to go in front of the cameras and to the reporters and said we did something.
Yeah, I understand. All right, John, as always, thanks for the update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and stay well.